Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free. I'm your host, Nita Valance, and star of the show is Dr. Marc Darrow, and we are taking your calls at 866-870-5752. That's 866-870-5752. And you want to call the program today and get Dr. Darrow's latest book called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And this is the definitive book on this stuff. It has 264 scientific studies. 264.
That's a lot. And what do the studies tell us, Nita? How to use regenerative medicine instead of having surgery. It gets into all the problems that surgery creates.
Elective surgeries.
Well, yeah, elective, but you know what? There's a big question. What does elective mean? There's way too many surgeries that are done where the surgeon says it's an emergency, and it really isn't. I'm not putting surgeons down, okay? I love surgeons, and I'm very grateful they go through all the training they do and go through all of the, I'm going to call it misery. It's not easy being a surgeon. You know, you can really hurt people. There are mistakes that are made.
A lot of pressure.
A lot of pressure. Even without mistakes, there's just things that come out bad when they shouldn't. My shoulder was one of them. I thought my surgeon, who was my boss at the time in med school, I was doing orthopedic surgery. I thought he did a great job. You know, he was doing these all day long, but it came out bad, and it taught me a lesson that I did not want to do this to other people, and I switched horses midstream from orthopedic surgery to physical medicine rehab and doing regenerative medicine instead. That's a big statement. That was not an easy decision to make because I loved doing the surgeries. But honestly, I saw too many bad results, and it freaked me out. I'm not, again, I don't put down the surgeons. I just think that there's way too many orthopedic surgeries that are being done that do not have to be done. The culture of orthopedic surgery is definitely against the culture of regenerative medicine. We're there to grow tissue back and heal it, and they are there to often patch things up and put them back together, which is great, but all too often to take out tissue. And the common thing we see in knees is what they call a clean out, where all the loose tissue is taken out. I think that's good cushion. They don't think so. They clean it out, and then later there's less integrity to the joint, and at that point it's very easy to get injured again and then have another surgery. And then in the knee, I see a lot of people go through a couple of surgeries, then a knee replacement that they never would have even thought about doing had they done regenerative medicine, platelets, and stem cells to start with. So I argue with my orthopedic surgeon buddies, and we don't come to any agreement. So just know, as a patient or someone who's inquiring, you're going to hear different stories about what's right. I don't think anything is right or wrong. It's just in the way I think about medicine, be conservative. Do the things first that you can't get hurt with. And those are the soft medicines, you know, things like acupuncture, massage, PT, all of those. Try that if you can. And then move up the ladder to more conservative things if the first fails. But, you know, we had Steve call in the first half hour. Thank you. I don't know if you're still listening, Steve, but I heard you say something like you did some regenerative medicine and then you finally had to do a shoulder surgery. Yours worked out great, so I'm very happy for you. But when I hear people, and I hear them say this every day, I had to get a surgery. They're like apologizing to me. You don't need to apologize to me. You did what you did based on all the information you had, but it's probably based on the fact that a surgeon told you you had to do it. And that's where the word elective comes in. What does elective means? It
Means I
you
choose.
It means the patient gets to elect, not the surgeon. Yeah, the eye is not the surgeon eye. The eye is you, the person that has the injury. So you get to elect. And then the question is it an emergency or is it elective? It's a big issue because I have a lot of people come and they go, there's an emergency. And I go, no, it's not. So medicine is not cut and dry. It's not black and white. It's still the practice of medicine. And I would always say if you're about to get a surgery, get another opinion. But get the other opinion from someone who is not a surgeon. Okay, not someone who's in that culture. Not the doctor that refers to surgeons. Go to someone who's against surgery. See what they have to say about it. There's a lot of types of medicine that don't like to have surgery done. So you've got to be careful. I'm going to give out the number to the studio right now. I'm going to send you a free copy of my book, which is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's all about stem cells and platelets and how to regrow tissue instead of cut it out. And if you call in right now, I'm going to mail you a copy of this book for free. And the number to the studio right now is 866-870-5752. That's 866-870-5752. If you do want to call my office, I'll give you out that phone number also. There's people by the phones there. That's 800-300-9300, 800-300-9300. If we don't cover a topic that you're interested in or you want more information. And for those of you who want to look better, we do this same procedure of regenerative medicine on the face. It's called the vampire facelift. And we just inject platelets and or stem cells into the face and regrow the collagen. As we age, the collagen in our body dries out. The face sort of becomes gaunt. The discs in our back that cushion the vertebrae dry up. We get shorter when we get older. The joints start to wear out. The tendons and ligaments dry out. It's easier to get injured. It's harder to heal. So with the regenerative medicine, the name is a great name of regenerating the body instead of doing surgery to it when you don't need it. And the regenerative medicine can be done on the face. It can be done on the top of the head to re-stimulate the hair follicles to grow. And it's an amazing process. I've been doing it for 25 years. And they say I'm the busiest guy in the world. I'm not so sure. But I know I am very busy. I don't even like, to my wife's chagrin, I don't like to take vacations. I like to be at my office. I love what I do. And I love, people say, what do you do for a living? I go, I watch people heal. It's a great life.
It is indeed. Shall we give the phone number again?
Yeah, give me a call now. Let's talk. 866-870-5752.
What else is happening in the office?
Just joy, happiness, and healing. I'm going to go to a caller, Nita.
Okay, yeah, but I just while the call comes up, I thought you could talk about what your wife does.
I already did.
Oh, okay. Okay. Never hurts to mention it again for the latecomers to the show. How about the website?
Yeah,
www.lastemcells.com. People can see you
Nita,
doing
you know what?
treatments on
I'm going to
video.
have to hit you up with a joke.
I think the call's coming in any second. I feel the call coming in. I feel it.
I feel
See?
it.
There it is. The little bar
There it
turned
is.
green. Okay, I think it's...
But we
Plus,
don't
I got to say the website in case somebody missed... it's a long website.
Okay, it's
People have to
Marilyn.
write it.
Marilyn, God bless you for calling. You just saved Nita. So you're calling about the vampire facelift. What's up? What would you like to know, Marilyn?
Well, I'll tell you. I had a dentist that I guess he was trying to take away all my wisdom because what he did was he kept pulling wisdom teeth. And so on my left side, my left cheek, it's getting sunken in
Okay.
because there's no teeth there.
Yeah.
And I didn't know this was going to happen, but it's been
Didn't you always
happening.
Didn't you always want dimples? Now you got them.
Well, I'm a little too old to be called Shirley Temple.
I don't know if the vampire facelift will help you or not. We'd have to see you.
Okay, well, I'm just so afraid of Botox because I have neuropathy.
Yeah.
And I'm afraid of something happening if I have Botox. What do you think about that?
Well, you always want to stay away from Botox if you can help it. But I don't know the answer because I haven't seen you. So you'd have to come in and see my wife. Michelle takes care of the faces. I do the rest of the body. So I'll give you the number to the office. It's 800-300-9300. You can set up an appointment with her. Okay?
Okay. Thank you so much, Doctor.
God bless you for calling, Marilyn.
Thank you,
God
Marilyn.
bless you.
You saved me. Thank you, Marilyn.
No, she didn't save you. She postponed.
She postponed the inevitable. Yes, I realize
Yes.
that.
So,
Well, I think
Nita.
we should give the phone number just one more
All
time.
right. It's 866-870-5752. You can talk to us right now and save Nita from going on the chopping block. But I got to sneak in a joke here for Nita
Okay.
right now.
Okay. I'll just
This
give
is-
the website one more time.
All right.
www.lastemcells.com. Not only can you see Dr. Darrow doing the treatments on videos, but you can email him off of every page on the site.
Exactly.
Very,
so Nita,
very happy with
do you
that
know
website.
why I want to go camping every year? You'll never get this one.
I probably will never get this one.
Because my last trip was so intense.
Oh. You
No,
camp out in a tent? I thought you had an RV, a giant RV.
I wish.
I would go camping in an RV, but I'm not going to go. I mean, when I was a kid, I camped in tents, but, I'm not 20 anymore here,
All right, Nita, you never get this one. I hardly even get it. You ready? I broke my arm in 2 places. Do you know what the doctor told me? Stay out of those places.
Oh.
See, Nita gets joke after joke
Oh.
until she laughs.
But we know what's funny? I did break my arm in 2 places when I was
Ooh.
17. In a car,
Oh.
I was thrown out the windshield in a car going downhill.
Wow, it made you look even prettier, I guess. 'cause
Well,
you're a
they
good-looking
pronounced
woman.
me dead at the scene. But I lived.
So you've
I'm
risen.
sitting here.
You've risen.
I'm like the cat with 9 lives.
So, Nita,
7 to go.
What do you give a sick bird? You might get this one.
You give a sick bird tweets.
Tweetment.
I said tweets.
You did. You did.
That's half a point.
It's half a point, but you didn't laugh, so we got to keep going.
Do you have any doggy jokes? I love dogs. You have 3 dogs, don't you? Or 2?
It's a 3-dog nightmare. No, I have 2 huskies, and Jensen, our daughter, has a little mini pincher chihuahua that comes over all the time. Used to live with us. What do you call, Nita, you'll laugh at this one. What do you call an empty can of Cheese Whiz?
An empty can of what?
Cheese Whiz.
Cheese? I don't even know what Cheese Whiz is.
It's like a cheesy whip. It's very good. Not good for you, but
I call it something to go on a cracker.
Cheese was.
Cheese was. No.
Okay, you didn't laugh.
Katie
Here goes
and I are both saying thumbs down, thumbs down. No,
Okay.
no.
What's the award for being best dentist?
New teeth.
A little plaque.
A little plaque. That's a good one. That's a good one. We'll give you that
didn't-
one. That's a
you
good
didn't
one.
laugh though. Sorry.
That's a good one.
Who invented the round table?
King Arthur.
Circumference. You're fake laughing.
That's hilarious.
I'm going to go to a question. Get you off the chopping block.
I
here.
was laughing all night long. When I was watching on TV, you're not going to
Tell
believe
me.
this.
Tell me.
Jerry Seinfeld has an old show on Netflix. It's called Comedians and Cars Getting Coffee. It
Oh
is
my God, that's
hilarious.
Absolutely crazy.
Have you seen it?
No, but I love that guy.
It's
a great,
you got to
he's so
see it. I
funny.
mean, he even had President Obama in the car one time. It was hilarious.
I think I did see that. Yeah.
It's like 10 years old or something, or maybe 12 years old. I just keep watching them over and over. And I always laugh like I'm going to cry. They're so funny, some of them.
I'm going to go to a failed spinal surgery and get back on point.
Okay.
How's that?
Yeah, because, see, it's going to be hard to make me laugh today. I watched Jerry Seinfeld all
I
night.
know. You have not been laughing much. So, I'm going to give out the phone number and then get to this next question on failed spinal surgery. A lot of people have had that. The phone number to give us a call right now, we still have a couple minutes left, is 866-870-5752. And if you want to call the office directly, that's 800-300-9300. So let's see what this person says. Ooh, this is a long one. Kind of funny. It says failed spinal surgery, and then it says a little background.
And then they wrote a novella?
Yes. Started having spinal issues 2016, undergone more spinal injections than I can count. Had L4-5 laminectomy 2017. That means part of the vertebrae was actually drilled out so that the nerve could breathe better. That goes down the lade. Oh, had a spinal cord SCS, which stands for, I don't know what it stands for. Oh, stimulator, spinal cord stimulator, SCS, implanted 2019. That can be something that's implanted so the nerves you can't feel the pain. No help at that. MRI CT scan showed severe degeneration, L4-5, L5S1. Ooh, due to years of heavy deadlifts. Careful, guys. I'm going to tell you exercises that I don't like. One are deadlifts, one are squats, and one are lunges. That's 3 different exercises I see where people end up with terrible back pain. Had a double fusion surgery August 21 to replace discs with cages. Have done PT, additional injections have failed to help. Symptoms now. Pain on right side after prolonged sitting or normal bowel movements. Had colonoscopy in September this year, no issues. Recent group of x-rays showed mild degenerative changes, both SI joints, hip joints, and the pubic bone, sacrum, coccyx, articulation normal. Could all these issues, along with my recent spinal fusions, have me out of alignment in pelvic muscle floor? I do feel as bad as standing, but prolonged sitting causes very tightening. I see neurosurgeon, again in December. Not sure what his take will be on this. Well, the take generally when you go to a surgeon is what? Surgery. So this guy's already been had surgery a few times with failures. So I don't think surgery is the right way to go. I would definitely love to see this guy or woman. I do know if it's a man or woman, but I don't want to say, to give away their story. So, yeah, I would say go to someone who does regenerative medicine. Go to someone who's an expert in it, who does it all day long. Don't go to someone who does it once in a while. Go to someone who does backs every single day. I could probably tell this guy or girl in literally 10 seconds whether we can help. And typically the areas where a lot of this pain come from are from sprains of the iliac lumbar ligaments or the thoracodorsofascia where it attaches to the pelvis, or the quadratus lumborum muscle where it inserts on the pelvis. I have tons of people that have had failed surgeries like this, and sometimes one treatment with regenerative medicine can heal everything that's going on, and then they go, why did I get these surgeries? I never needed them, and they hurt me. These are not fun surgeries to go through. Thank God I've never had one, and I don't ever want one. So if you're thinking about getting a surgery, please consider calling us at 800-300-9300. Get someone with a different take, a different point of view, somebody outside the traditional medicine box.
And if they want to talk to you right now, what's the number?
Call us now. Let's talk. 866-870-5752. I'd love to talk to you. I love saving people from surgeries. And it's a conundrum for people because they go to a surgeon, they're told they have to get a surgery. The only way that can save them from I've heard people say, the doctor told me I'd be paralyzed if I didn't have this neck surgery. And guess what happened to them after the surgery?
They got paralyzed.
Got paralyzed, yeah. There's one guy, told the story, I don't think I've told it for years. He came in when I was working at the VA in West LA on Canadian crutches. His legs were very, very weak after a neck surgery. He had some neck pain, and the doctor did a neck surgery, told him he'd be paralyzed if he didn't do it. He wasn't paralyzed, but close to it. And then we did a test of his vitamins. It was found that he was very low in B6 and B12. Guess what we gave him?
Gave him the vitamins.
Yes, and guess what happened?
He got better.
He got better just from that. Is that insane?
Well,
It's called traditional medicine. Watch out for traditional medicine. Go to people who think outside the box if you're going to a doctor. I see traditional medicine doctors, but at the same time, I also talk to myself, an alternative, quote, alternative. It's not alternative. The type of medicine that I do has been around since the beginning of time. It's just alternative to the tradition of what's going on right now. So we have to be careful. It's always good to explore and find easy ways and conservative ways of healing rather than things that are invasive. So I'm very sorry this person had these surgeries. Is it still possible that I could heal them by injecting PRP or stem cells? Absolutely. Absolutely, it's possible. Should I take another question before we close?
Sure. Yeah, absolutely.
Ooh, this one sounds terrible. Ankle fusion amputation question.
Ouch.
This is kind of a long question also. I had a talar neck fracture dislocate Hawkins 4 in March 2006 from a fall off a ladder. I get people falling off of ladders all the time. They're terrible injuries. It's sad. This past February, I did a lower ankle fusion, then had a total ankle replacement done in March due to severe arthritis in the ankle. After that surgery, I had issues getting the skin to heal. Tried a wound vac, Integra skin infusion, then had to do a lower calf flap surgery. Boy, this person's going through it. That person, I don't like should-haves, but they should have been getting hyperbaric oxygen to heal that skin rather than cutting it again. Then some of the skin on the flap didn't take and had to regrow skin over the flap. So this is terrible. Yeah, this hyperbaric oxygen can heal those kind of things. Finally, it closed in early September. I went through rehab, started to get the ankle motion going back, moving again. Now here in November, ended up with staph infection to the ankle. That's bad. Total ankle had to be removed. Now I'm given 2 courses of action. I can either get a total ankle fusion with a rod through my heel connecting foot to leg or have an amputation. Whoa. Very active person, loves motorcycle and golf. Any thoughts? Well, the thought's always the same thought with anything in medicine. Do the conservative thing first, and that would be to see doctors who do regenerative medicine, see if that's a possibility here. It may be, it may not be. I don't know. A lot of cases I've seen where I tell people not even to come in because I don't think I can help, and they badger me and say they're not going to get the surgery, and they come in, and we sometimes can help them. So I'm sorry this happened. I'm sorry all these surgeries took place, and I don't know the answer. This is definitely a person I have to examine. God bless you all. If you want to call the office, the number is 800-300-9300. If you want to go to my website and watch videos of me doing these procedures, go to www.lastemcells.com. Thank you all. God bless you, Nita. And
thank you, Katie.
staff.
Thank you, Suzette. And remember to hear our pal Warren Eckstein from 11 to 1 on the Pet Show every Saturday. I'm Anita Valens. We'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. right here at AM 870 The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.